So we spent 5 minutes in which I glided the left femur anteriorly. And I did that by weaving my right hand underneath. And then I just blocked the tibia. And then I just lifted up with my forearm, but it wasn't very visible. So it looks like I'm doing nothing, but I'm really lifting up with the right forearm. And I did that for 5 minutes. And that restored more normal movement. So now I can take it the slack and I can spring it and it has mobility. After that, we treated the shift in the pubic joint by placing this foam under the left ischium. And we did that for 5 minutes, and at the 3-minute mark, she started to feel like something was happening. And then we took that out, retested it, and at that point we achieved symmetry at the pubic joints and normal anterior spring when she was lying on her stomach pushing on that left ischium. So then we had her lie on her stomach. Go ahead and roll over. And we placed a vertical piece of foam like this under each side. So we did that on both sides. We did that for 5 minutes. We repeated it for another 5 minutes, and then I leaned very gently, about 10 pounds of force, maybe 15, onto the sacrum for 5 minutes. And I'll take this foam out now and show you the result of that. And she was aware of differences before she even got up off the table. And now I can create spring mobility with less than 15 pounds of force, taking up the slack and then springing. We now have movement with the PA spring. And this is sacrotuberous ligament. It should have a little tiny bit of give, and it does now. There's a little bit of yield there. I'm on the sacrum. I can spring it now. And before, when I would come off these bumps called a PSIS, I would bump into the sacrum, and now I fall down into the sacrum. There's now a sulcus. And now my thumb on the midline of the sacrum is deeper than the thumb on the ilium. And here is inferior glide mobility, so that's much better. And then you got up and walked around, and you went and sat, and you said several really insightful things. So you can go ahead and sit up, and I have the camera pointed somewhere else. And can you tell us how you felt in standing up and walking and sitting?
I felt very loose, and I felt like nostalgia for this is what walking used to feel like years ago.
Interesting. Very good. Anything else?
Normally when I'm put in alignment, I feel crooked because I'm so used to being crooked that feels straight. And this time I still feel straight, even though I am straight.
That's interesting. I like the way that sounds. And how about with sitting?
I didn't have the immediate urge to cross my right leg over my left that I normally do.
Very good. So I'm very encouraged. It's an interesting case of primary symptoms in the hip joint, but the hip eval itself was fairly normal, except at the bottom of the hip bone, the bottom of the thigh bone, the femur at the knee, was stuck in posterior glide. And that just doesn't get better on its own. It needs an external force to move that forward. And then the shift in the pubic joint affected all the muscles around the hips. And the wedge of the sacrum being stuck backwards. You had no movement in your pelvis. Now when you walk, your pelvis has a lot more freedom to move about. Mm-hmm. Now walking is a lot freer.
Yes.
So we're off to a good start. There's more stuff to be done with you. I need to check the side glide of the pelvis. Remember that restriction going left to right? We'll need to check that on the next visit. And I'll need to check the upper cervical spine, a common place of compensation for this pattern. And and then just retest everything and see how it's doing. But I really feel like we're off to a good start, and I think that there's a significant potential for you to keep this benefit and continue to improve. So thank you. It's a great case study, and I appreciate it.
Thank you.